Over the last 24 hours, we have identified 1,738 new cases of COVID-19 in Alberta and completed about 21,000 new tests. Our provincial positivity rate remains high at about 8.3%, and we now have 20,161 active cases. There are 684 people in hospital, including 123 who have been admitted into the ICU. Sadly, there were 18 deaths related to COVID-19 reported to us in the past 24 hours. My sympathies go out to those mourning their loss. I know the current gathering restrictions continue to make it challenging for the family and friends of these individuals and for anyone who has lost a loved one to any cause to grieve in the ways that we are used to. Please reach out in other ways to those you know who are navigating a difficult time. In schools, there are currently active alerts or outbreaks in 458 schools, or about 19% of schools in the province. Currently, these schools have a combined total of 1,947 active cases. This number includes 293 schools with outbreaks, including 123 currently on the watch list. I know Albertans continue to watch these numbers closely, particularly for what it means for our acute care facilities. I want to share changes that Alberta Health Services is making to their designated support and visitation guideline. AHS has made the difficult decision to limit on-site designated support people in all acute care facilities. Effective Monday, access for designated support persons in AHS acute care settings will be limited to just one designated support person for each patient in ambulatory care, emergency departments, urgent care, maternity or postpartum, and other inpatient areas. Access will be limited to up to 2 designated support persons for each patient in critical care, pediatrics, and the neonatal intensive care unit. In many facilities, these new guidelines will mean little change from the regulations that are already in place. There are some exceptions and exemptions, so patients and families entering AHS facilities should contact the care team directly or visit ahs.ca/visitation before entering. We know these restrictions will be difficult, especially during the holiday season, but they are needed to stop spread of the virus and to keep patients safe. We must do everything possible to bend down the curve. There is no other option. Bending the curve is also why we have launched a new marketing campaign that uses humor to reach Albertans under 40 and anyone else who may have tuned out our other messaging. These ads feature a personified character representing COVID-19 at gatherings and in various other social situations. These ads were filmed last month under strict protocols to protect the safety of everyone present. The cast and crew were required to follow these strict protocols, including screening, off-camera masking, and distancing at all times when the camera wasn't rolling. Our goal is to get people's attention, to help them see common situations from a different perspective, and as a result, to influence their behavior. The campaign uses humor because the situation is serious, and we need to use every tool at our disposal to reach all Albertans. Lives depend on our ability to bend down the curve and reduce the spread of COVID-19. I want the families of the 684 Albertans we have lost to this virus and everyone currently fighting it to know that we are using every communication tool we have to help stop the spread. We looked at a variety of options, and as you know, we have been working very hard, as I've said, over the past few months to think about what options we might have to reach out to Albertans, particularly in that 20 to 39-year-old age group, where we do see a large number of our cases. We know that Albertans in that age group are at the lowest personal risk of potentially having severe outcomes. However, they also, unfortunately, can spread the virus to others and be a part of that onward rising of the curve. And so we wanted to find an option that could effectively reach them. So I was part of the team that looked at various options that were really aimed at effectively reaching out to that particular age group, and again, others who may have tuned out the more serious and fact-based campaigns. We are continuing the serious and fact-based campaigns. Those have not stopped. But we felt that it was important to add an additional tool, again, to communicate more effectively to groups that may not have been taking our messages seriously, and to use humor actually to help them take the message more seriously. The recommendations of the National Advisory Committee on Immunization are that at the beginning of our vaccination campaign, because at the moment we don't yet know exactly how long immunity will last, we don't know specifically, again, with a vaccine that's 95% effective, there is that 5% for whom it may not offer complete protection, that the kinds of measures that are in place right now, especially in the first couple of months as we're still learning about the vaccine, public health measures will need to stay in place even for individuals who've received the vaccine. Vaccination will not be mandatory. It is a choice of an individual to receive the vaccine. So the priority groups that we've described are the groups that will be eligible, should they choose to do so, to receive the vaccine. And again, we are going to be, of course, learning more, monitoring very closely the ongoing information about the long-lasting nature, how long that vaccine effectiveness lasts. And also, of course, we know that in the first tens of thousands, over 40,000 doses that were administered, there were no serious adverse events reported. But the vaccine safety is an incredibly important thing that we're going to be monitoring for. And so we want to make sure that all of that information is available to people as they make these decisions about whether or not to take the vaccine.